Just testing out the audio and video, guys. Hi, Doc. Welcome. I'm just setting up, testing the audio and video, testing the live stream, getting everything set up. Haven't started yet. Cleopatra Shaw, can you hear me? Can you say something? I want to make sure that the audio is good and the video is good. Just checking. People on YouTube, I'm just checking the audio and the video. Let me know what's the stream looking like. You could comment in the chat on this live stream. Let me know what the audio sounds like and the video looks like. So make sure that everything is running good come 10 minutes time. Checking audio. And somebody respond, can you hear me?
Yeah. All right, bless you, man.
Hi, Trish, welcome. Dr. Barnett trying to join. Trish, I'm
Hey.
here. I'm just setting up. Just give me a sec. We'll go
Sure.
live.
So you will do the PowerPoint, right?
Yeah, I'll do it from my end.
Okay, great.
All right, just stand by.
Yeah, man, no problem. My lighting is good.
Let me see.
And my background.
Yeah, Gary. And Jan.
To the world and unite their efforts with those of ministers and church officers. That is taken from Gospel Workers, page 3. Paragraph 2. Well, brothers and sisters, we go into that paper. Are you happy to be alive? If you're happy to be alive, let me hear you say amen. If you're happy to be alive, let me hear you say praise the Lord. Well, this morning, we are delighted to be here with you to share in the adult Sabbath school. I have with me Dr. Tamar Douglas. Dr. Douglas, President.
Somebody's hearing something in the group whose mic is open.
Where we will have children's lesson on that side. Is that okay? Right. The next announcement is that all tithes and offerings that would have been will be stated. Who are talking about? The church will follow once you get the tithes and offering, then you will get your church. Are we together, friends? Talk about this. So friends, we have
sorry.
Hi, good night, everyone. We are just about to get started. My presenters are here. Audience is coming in.
Yeah,
Ms. Franson, please mute your mic. Thank you. Okay, we're giving a little more time for a couple more people to come in. People are coming in. I'm admitting them to the room. We're going to get started in a quick minute. We are also live on YouTube.
okay. Right, thank you. So, am I going to be hearing him good?
Yes, he's not talking at the moment.
Okay, Dr. Thomas. Sister, my name is Dale. My name.
Yes.
Karen Clark.
Yes.
Okay, what am I there? Oh, good.
All right, I'm testing my mic again. Can you guys hear me clearly?
Loud and clear, loud and clear.
All right,
Loud
awesome.
and clear.
Can,
You have good visual. You can see me clearly.
can
Again,
speak
more light.
clearly.
Let me get more light in here. Okay, that's better, right?
That is better.
Oh, awesome. Okay, we are getting there. Can someone check the live stream for me on YouTube? Make sure that we are streaming. Okay,
Streaming live, streaming live.
live stream is live. Awesome.
It's
Dr. Patricia, you tested your mic already. Good. All right. So we are almost there, guys. Just a few more reminders to send out to a couple of people. Okay, we are ready to go, guys. Good night, everyone. It is a pleasure for me to welcome you back to another in the series of monthly seminars. And this evening we have a very interesting and informative program as usual. I'm happy to see so many of you out. People are still coming into the room. The room will be full in a minute. And we'll be having a number of persons resorting to YouTube, which some have already joined us on YouTube. And so tonight, the format is going to be 2 speakers, one after the other, after which you will be allowed to ask questions. We hope to be out of here in another 90 minutes, which will take us up to about 8:37 p.m. So for those of you who are joining us on this series for the first time, this is a product of the Be Healthy group, a WhatsApp group created 3 years ago with the vision of helping like-minded people begin and continue their health journey. It is said, and I always like to quote, that if you want to go fast, go alone, but if you want to go far, go together. So we have decided to go far and to go this journey for long. So we have created a group which basically embodies the spirit of togetherness, encouragement, and sharing, to share information, share insight, to encourage each member to instill into their lives healthy habits and maintain them for the long term. And so far, we have had hundreds of lives changed, thousands of people touched and educated. And tonight, we're continuing on that quest to spread information that is not just available readily. We try to find the best speakers from anywhere that they are located, people who have experience, people who are on themselves, on the health journey themselves. So tonight we have two special speakers. But before we get into tonight's program, I am going to ask us all just to pause as we invite the Lord's presence with us. Heavenly Father, we are indeed thankful and grateful for another opportunity to learn, to take a minute to pause and learn how to take better care of this amazing gift of a body that you gave us. Father, it is indeed a blessing that we acknowledge tonight that we are fearfully and wonderfully made, and we acknowledge our responsibility to take care of our bodies. And we commit, Lord, all of us tonight to do all we can to give glory and honor to you by taking care of our bodies. In Jesus' name I pray. Amen. All right. So I'm going to take a quick minute and ask, is there anybody on the call tonight or on the Zoom tonight or in YouTube who is joining for the very first time? You're coming to one of our meetings for the very first time. Can you open your mic and say a quick hello, who you are, where you're from? Quick, one at a time.
Hello, my name is Cherie. I'm from Canada.
Welcome, Shireen. Lovely to have you. Anybody else?
Hello. Hello, my name is Hillary and I'm from the UK.
Hillary from the UK. Awesome. Welcome, Hillary.
Hello.
Hillary from Jamaica on the call. Hillary, close the mic. Oh, go ahead, guys.
Oh, I was just about to say this is Hillary from Jamaica, but I'm vacationing in Florida.
All right, Hillary. On vacation in Florida. All right. Anybody else is joining for the first time?
Hello.
Myself from Jamaica.
Hold
Myself
on.
from Jamaica.
All right. Awesome. A lady voice said hello. Who's that?
Hello, it's
Karen
Valerie.
Clark from Jamaica.
All right, Karen from Clarendon. All right. Anybody else?
Yes, it's Valerie, Tevin mommy.
Valerie's not the first time you come on the call, man. Stop telling lie. Is the first time, Valerie?
Dr. Tina burst your bubbles, so.
All right. Anybody else? First time?
No,
Yes, sir. Olivia, Red Ground.
All right, Olivia, big up yourself. It's wonderful to have you. Anybody else quickly? We're going to start.
no,
Georgette.
from David.
So like one dog I did.
Not hearing clearly.
Georgette.
Georgette from where?
Old Harbor, I'm here to support Trisha tonight.
All right, Mrs. Harrison, it's beautiful to have you.
Thank you.
All right, so I'm going to ask everybody to mute their mics now. We are 7:12. And so tonight we have two very special people who are on to present to us. I'm going to present them just immediately before they speak. And so I'm going to bring on screen. Hold on. Everybody, please mute your mics.
Excessive force comes to mind. This works on my kids every time. Okay, nobody wants to go through this. Eventually, you're gonna turn on the guilt. She ran it for save for 42.
Dr. Thomas, there's a message in the chat that says they're not hearing you, but you are clear. I'm hearing you clearly.
Okay. My computer for some reason a little slow. I'm just trying to get the technology going. Okay, so it is my absolute pleasure, guys, to introduce to you our first presenter for tonight. She has a long history of excellence. After leaving school, this beautiful young lady wanted to pursue a career in singing, I was told. However, her mother had other plans for her and instead insisted that she go to beauty school. After completing her studies, even before completing her studies, she began her business, Shades of Elegance, on her mother's veranda. Today, this awesome woman is the CEO and managing director of a growing multi-million-dollar business called Shades of Elegance. Indeed, her rise in the business sector has been recognized, as in 2015, she was a Scotiabank Vision Achiever. She is formally trained, as I said, she's a cosmetologist. She's also a certified aesthetician. She is a consultant trichologist who is a member of the International Association of Trichologists. She is a VTDI and NCT Vet Development Officer. She is involved in her community in a number of ways, being the present president of the South St. Catherine Chamber of Commerce. She is a PTA president at Marlemont Primary School. She is a donor and mentor for girls at St. Mary's Child and Yaddle's Home for Girls. She is a mentor and motivational speaker to hundreds of young people all across Jamaica. She has been featured on television Jamaica, The Gleaner, The Observer, Old Harbor News, JIS News, and various other media houses. She lives by the philosophy, discipline is refining fire by which talent becomes ability. Trisha Reed is the mother to the brilliant Alex, who I am proud to be a mentor for. Ladies and gentlemen, I am proud to introduce to you my friend, my mentor, my colleague, and your first speaker, Trisha Reed. Please, guys, indulge me, open your mics and make some noise for this amazing woman, our first speaker tonight.
You go,
Go Trisha, go Trisha, go Trisha.
Looking forward to it, Trish.
Listen, this doctor is something else now, because I was just wondering, what is he talking about? I don't think I know the person who he's talking about. But if he insists that it is me, then I just have to accept. I just have to accept it. But good night, everyone, and thanks for, the wonderful welcome, the warm welcome. And I must say thanks very much to the Be Healthy family and Dr. Thomas for inviting me on this platform this evening to share the knowledge and the umpteen of other persons. Dr. Thomas, are you able to mute everybody that is on? Yes, I was asking if you're able to mute everyone that is on, Dr. Thomas.
Yes, I'm trying.
Okay, great. All right, so I must say a special thank you again, and thanks to the Be Healthy family for inviting me on this presentation tonight. And I hope that after, divulging the information, I hope that I'll satisfy everyone's hunger, and I hope that I'll be able to quench each of us thirst this evening. So we're here to talk about skin. and hair, of course. And I must say thanks to my colleagues who jump on to support me, the persons who are not a part of the Be Healthy family, but they jumped in from Canada, from Kingston, from Clarendon, from Old Harbor here. Thank you very much for the support. Now we're going to be jumping into our presentation this evening. And as I said, we're going to be talking about beautiful skin. And I know that as men and women, more so women, we focus on our skin and our hair because our skin and our hair is our glory. Our skin is very, very important. But I'll ask this question, and I'm going to ask this question to everyone. What is skin?
Pleasure. Don't put your thoughts on those. Just people spoke today about joy. I mean, inner joy.
I hate to talk when so many other persons are talking.
I'm trying to figure out who it is.
All of those things you can have deep joy and happiness in it, but those are
Rowena Palmer is
unmuted,
Georgia.
Perfect. Claire. Thank you very much. So as I said, we are going to be speaking on hair and skin and scalp, hair and skin this evening. Now, as women, we pride our hair and we pride our skin. And I'll ask this question, what is skin? And I'll answer by saying skin is the largest organ of the body. Skin serves as it protects our inner organs, it protects our skeletal, it protects our muscles, and it helps against hazardous factors of the environment. Can go ahead, move on. Against the environment. Now, skin has 3 different layers. Skin has, thank you. Skin has 3 different layers. It has the dermal layer, the epidermal layer, and the subcutaneous layer. Now, what we will focus on tonight, or what we will be focusing on, is our epidermal layer, which is the outermost layer of the skin, and that's the area that we are able to touch. The dermis is the innermost layer, and the subcutaneous is the inner layer. And as we can see the diagram here, we can see the oil glands and all of that, where the hair come from and the nerves, the papilla, and all of that. All right, so we are going to be focused on the epidermal layer. And the epidermal layer is what we need to take care of. It is one that we need to pride, it's one that we prize the most. All right, so we have different types of skin. We have 5 different types of skin. Gone were the days we used to focus on 3 types of skin, but now, I mean, technology increased. We are learning more. We are now focusing on 5 different skin types. Now we have the normal skin, we have the dry skin, we have the oily skin, we have the combination skin, and we have the sensitive skin. Which are you? Which one of the skin do you have? Because each of these skin types are cared for in a different way. We use different products. We use different skin movements to enhance, to maintain and enhance the skin. So we are going to be focusing on normal skin tonight first. So the normal skin, how we care for the normal skin, as it says normal, it's not oily, it's not dry, it's not sensitive, it has no sensitivity, it is normal. But even though that skin is normal, we need to maintain that normalcy, all right? And what we would do is our regimen, skincare regimen for everyone. And for all 5 skin types, we need a skincare regimen, and which is cleanse, tone, and moisturize. That's a must for everyone. And then we need a sunblock, especially with this climate that we're having, and with this summer, the heat that we're facing, the sun, the rays of the sun is closer down on us. We need our SPF, we need our sun protectant factor, all right, which is our sunblock. All right, so At home, we need to cleanse, tone, and moisturize. For normal, for home, natural skin, natural products, we can use homemade products. We can use lime, which is citric acid, which is comprised of citric acid, vitamin C. The lime helps us to rid free radicals from the skin. We can use our aloe vera. We can use our normal sugar that we use to make lemonade. We can use our cornmeal. And what the cornmeal and the lime would do is to exfoliate. We don't want to exfoliate too much. We don't want to over exfoliate. So I would recommend that you exfoliate once every 2 weeks or once every 3 weeks. And we need to exfoliate because we have to exfoliate the dead skin layer. And guys, our cells change every day, but we have a built up of cells turnover every 4 to 6 weeks. So every 4 to 6 weeks, we need to get rid of those dead skin cells. But we will have an over built up of dead skin cells by 3 months, 3 to 6 months, all right? So let's move on to oily skin. I'm going to tell you something about oily skin, and I want you guys to pay attention. And I know a lot of us are not going to agree with me this evening, but oily skin is one of the most important skin. I have oily skin. And why it is one of the most important skin is because you have an overproduction of sebum, right? While having an overproduction of sebum, your skin keeps moist, it keeps hydrated. If it is that you should get a cut or a bruise, or you should squeeze a pimple and you get a dark spot or pigmentation, it won't stay for long. Because of the oil that the skin keep producing, you don't get dark spots for long and your wound will heal quicker than the norm. So please, ladies and gentlemen, when you realize that you have oily skin, stop cursing and behaving as if it is a curse. Oily skin is not a curse. Oily skin is a blessing. One of the things too, what you would love to hear, and for the ladies, once you have oily skin, you tend to age. You don't age as quickly as you would normally age. Oily skin helps us to maintain our youthfulness. All right, guys. What we need to do though, instead of using products to remove the oil, we need to use product to balance the oil in our skin so that our skin can maintain its luster, its moisture, and its pliability. One of the cleanser that we need to use for oily skin, we need to use products that has in like salicylic acid, products with not too much alcohol, but the salicylic acid shouldn't be too high in the product. It should be on the lower end. We can use benzyl peroxide, products that has in benzyl peroxide, but not too much. And also, acne goes hand in hand with oily skin. So if it is that you suffer oily skin, but you have a breakout of acne constantly, then you would resort to the benzyl peroxide or the cleansers with salicylic acid, the moisturizers. Also, you can use a clay mask once every 2 weeks. What the clay mask will do, it will help to absorb some of the oil that is present in the skin. Right? And also the toner, we can use which is the toner. Guys, what a toner does, a toner is very important because what the toner does, the toner helps to balance the pH of the skin. Right? And once the pH of the skin is balanced, then you have a healthier skin. You might say, what is a pH? The pH is potential hydrogen, and the pH, it ranges from 4.5 to 5.5. So I don't want you to use anything that is over 5.5 on the skin as a cleanser. We need to maintain the range of 4.5 to 5.5 as a cleanser. Whatever you're using on the skin, maintain your range of 4.5 to 5.5. All right, guys. And again, aloe vera is excellent for all skin types. I won't stress that. I won't stop stressing the aloe vera use of all skin types. You can move to the next slide. And guys, you can write down your questions because we are going to be answering the questions when the presentation is finished. So please write down your questions so you keep them fresh in the mind. All right, so dry skin, as you can see, this image on the screen, it's cracked. It has look like orange, and it just like our orange skin, orange peel looks, that's the same way you identify dry skin, right? So dry skin, we now need to use products that will infuse moisture into the skin. The aloe vera is excellent because the aloe vera, it has antibacterial properties, and it is also an excellent moisturizing content. It also has in humectant, and humectant helps to penetrate into the skin better because the molecules of the humectant are small, so the molecules will penetrate the skin quicker. Oil, the molecules are large, and because the molecules are so large, it takes a longer time to penetrate into the skin. It sits on the skin and collect grease and dirt. So guys, please remember, aloe vera, use of your humectants instead of too much oils and oils and oils. All right, guys, use alcohol-free products. Once your skin is dry, you don't need products that has in alcohol and sulfate and stuff like that. All that is going to do is to dry the skin even more and cause blackheads and cause the skin to look aged quickly and look older. All right, guys, so we want to stay away from that. And as we women, we want to live on Young Street, 1A Young Street instead of Old Hope Road. I know that we don't want to live on Old Hope Road. All right, so can we move on? All right, and as this says, combination skin. Combination skin, as the word says, combination. Combination, it means that we have a range of different skin types. And as you can see in the T-zone area where the tape is across, that's the T-zone. Sometimes that area can be oily on the jawline, it can be dry, on the forehead can be a little bit sensitive. Sometimes we have sensitivity going in the crease of the nose. So for some persons who suffers eczema, the other day Dr. Thomas had a live on TikTok. I know he was talking about yeast. Sometimes yeast live between the nostrils. So it is that type of skin you call combination skin, but now you need to use the different products that will alleviate the issues that you're having. So you would now need to combine two different products. If it is that you have oily skin and dry skin, then you need to combine both products in order to balance and even out the skin condition, the skin type, so that you have a balance. And guys, everything that you do, it's in moderation. It can't be that you're going to be doing one thing every single day. You're going to be using a scrub every day. You're going to be using your alcohol every day. No, because if you do too much of one thing, it is good for nothing. So we have to balance what we do. In the Be Healthy group, we stress on healthy eating, we stress on exercise. And guys, remember, what we do is what we live. Anything that we do, it's what we reflect. All right, so for sensitive skin, as you can see, it has redness, it has inflammation, it tends to be itchy, it tends to be stiff, it tends to tingle. Everything you put on that skin, it will tingle. No, for sensitive skin, aloe vera, aloe vera, aloe vera, aloe vera, honey, honey, honey. The same milk that we used to drink, the Lascala soy milk, the white one, the green one, you can mix that with a little honey, make it into a paste, and also apply it as a mask to soothe. You can use it with the aloe vera as well, and it soothes the sensitivity. It reduces, the aloe vera will reduce the redness that you're seeing, that you're having. Also, guys, for your dry skin, the pear that we eat, the avocado that we eat, mix a little avocado with your honey, make a paste, apply it to that dry skin, and you'd never believe how the skin will feel after removing it. So guys, yes, you can't afford to come into the spa to get your services done, but you can still take care of your skin from home by knowing the type of skin that you have. By knowing the type of skin that you have, you definitely have to get a consultation. For the Be Healthy family, we are definitely offered a 10% free consultation for the next 2 weeks in August. I'm not sure, correct me if I'm wrong. 10 free consultation for the rest of the week in August, and then in September the Be Healthy family get a 10% discount on all consultations. And I'll stress on it, just as how you need to go to the dentist to remove plaque from your teeth, is the same thing, same way you need to go to the spa and get a deep facial done. Why? For example, if you look on the screen that we have now, this is a client who came in for a facial, and this was the condition of her face before the facial. And you can see a lot of dense skin cell. You can see a lot of whiteheads coming up. You can see everything coming up on the skin. But then after the facial, look at the skin. Look at how glowing that skin is. So it's just the same, as I said before, every 4 weeks, you have a build-up of dead cells shedding. After 3 months, you will have a build-up of cells because your cells turn over. Every day, you have different cells turning over. Based on cells turn over, you have dead skin cells. You have to get rid of those dead skin cells. And how you get rid of those built-up dead cells is by going to the professionals and get those dead skin cells. What she did basically though was a microdermabrasion, because when she came in, the microdermabrasion was the only thing that we could do to reduce all of those dead skin cells. All right, guys, so that is it for our skin and how we take care of our skin. And we are going to go into what would be a presentation be without us consulting about hair and hair care. Now, what is hair? Hair is an appendage of the skin. And hair serves for protection, adornment of us as women. With our hair, we are beautifully adorned with our hair. Our hair is our crown and glory. Also, if the shaft that is on our head, it protects the skull, it protects the scalp from any bounce or bruise or whatever it is. We were perfectly and wonderfully made by the Lord. And for that, you know, we are grateful, truly grateful for that makeup. Now, our hair is made up of protein and iron, right? Our hair gets food from the blood, sorry. And our hair gets food from our blood is made up of protein and iron. Now, if it is that our hair is made up of protein and iron and it gets food from the blood, then our iron level needs to be up, our protein level needs to be up, and the hair is 97% protein. The other 3% is lipids and water and all of that other great stuff. Now, if it is that we garbage in, garbage out. Whatever we put in, that's what we get out. Oftentimes, we use serums and say that, okay, my hair is breaking out, I'm pulling it out, I need my hair to grow, my hair is damaged. No, we tend to use typical products, topical products to grow that hair. No, the hair will not grow. It's based on what you put in. It's based on what you eat. It's based on what you do that will grow that hair. So if the cells are not healthy in the body, then the hair won't grow as healthy as it should. Yes, topical will help the hair to stay on the head, and it will help the shaft to remain healthy. And what we also find too is that the shaft is different from the scalp. And remember that skin is scalp and scalp is skin. So however we treat our skin, that's how we treat our scalp. But we can't treat our scalp the way how we treat the shaft on our head, the hair. No. And for persons who are suffering from like seborrheic dermatitis, dandruff, eczemas on the scalp, oftentimes my trichologist colleagues are on as well, and they can attest to this. Oftentimes clients will come in with a shampoo, because we definitely have the ketoconazole shampoos, the coal tar shampoos, the salicylic shampoos to alleviate those conditions, but we can't use it on the shaft. So oftentimes clients will bring those shampoos in for us to treat the hair, but we can't. We can treat the scalp with it, but not the hair. All right, guys, we can't do the same. We can't do the same thing to the scalp, what we do to the shaft. The canvas is there for us to take care of. The canvas has to remain moist. As it says, it is a fiber. The hair strands are fiber and it needs moisture. We have 27 different textures of hair. We have fine hair, coarse hair, medium fine. Those three are the basis. And then the others derive from those three. So we have medium fine hair, we have coarse hair, we have fine, we have coarse. The shampoos and conditioners that we use on our coarse hair, we can't use them on our fine hair. For persons who has straight hair.
Hey, Trish.
Yes.
Sorry to interrupt you. I have a little technical glitch. I'm asking Sandrine to just pay attention, give back the host to me, Sandrine, so I can share screen. Sandrine has host privilege, and give back to me, Sandrine. Thank you.
Yeah, but I can speak in the meantime, right? To save on time.
Go ahead.
Okay. Right. So as I was saying that we can't do both. We can't use the same thing that we use on our scalp on the shaft. All right, guys. And in order to treat the scalp and the hair, we need to separate the two. So if it is that you are having your scalp issues and you're having scalp disorders, if it is that you're having itchy and flaky, if you stay home and use any shampoos, then you are breaking your hair. You're causing the breakage. All right. And you can't use the same products on a straight hair like what you use on a curly hair. And for persons with straight hair, their body all of us produce natural oils. But for persons who have straight hair, the ability for the natural oils to run to the end or the mid shaft is good, is maybe 50%. But for us curly, kinky hair, the percent is maybe 0 to 1% that the natural oils won't reach mid shaft. The farthest it will go is to the zone 1, because our hair is kinky, curly. So there's no way the oil is going to go through all of those coils to reach to the end. But for straight hair, the oil runs straight to the end. So hence, persons will say, oh, my hair can look like fair hair. You know why? Because her makeup, her genetics is different. And her hair can withstand certain products, certain the irons, the chemicals, but our hair can't. Our hair can't. Another thing too, I want you to understand is a lot of times we use the Vaseline and the Blue Magic hair oil. No, guys, what we're doing, we're killing the hair, especially with this climate outside. All that does is fry the hair. When you put that oil on that hair, all it does is fry. Just like how it fried the skin and your skin get black and dark and hard due to the sun, is the same thing it does to the hair. Because remember that the molecules of those oils are so heavy and large, it cannot penetrate the cuticle scales of the hair. It cannot penetrate it any at all. So we need to use humectant, because remember the hair is hydrophilic, so the hair loves water. Water will penetrate the hair as easy as 1, 2, 3. The oils will not. The oils will sit on the hair. Oftentimes we see videos and persons say, oh, coconut oil, this oil, that. No, the oil will sit on the hair and create a barrier on the hair. All right. And then once we go out into that wind, pardon me?
Right now, you have the screen is up now.
Yeah, man. Thanks. So what we see is the skin, the hair gets fried and dry. We can't do that. You have to use products that will penetrate the shaft of the hair, and as I mentioned, the shaft is the ends. What you're seeing on the screen now with this lovely girl with her hair out, that long hair, is the shaft. So whatever we put on the shaft of the hair, the canvas, you have to use things that will penetrate the canvas as best as possible. Makes no sense you use the heavy oils because all you're doing is killing the hair, guys. All right, that's all we're doing. We need to ensure that the hair is hydrated properly. Yes, we can use our avocados as moisturizers at for home, but you still need to visit your professional, because oftentimes the products that we use, you have built up on the hair. And you get rid of built up, we definitely have to exfoliate. Just as how I showed you the young lady's face with the built up, is the same way the hair will get built up of products on the hair. So we need to get rid of it by exfoliating the scalp and exfoliating the shaft. And when I say exfoliate, we do scalp detoxes to clean the scalp so the scalp can breathe, the scalp can energize. We send energy to the follicles. And remember that each follicle is connected to a papilla, and each papilla is connected to a bloodstream, because that's how the hair gets its food. All right, guys, what we can do is exercise the hair as well as a home regimen. Exercising meaning brush. We brush and we do stuff like this. We massage. And the same thing for the skincare products. The hair is 4.5 to 5.5 on the pH scale. We can't use any product over the 4.5. If we do use it, then we have to bring it back to its acid mantle stage. For example, our relaxers, the relaxer is not 4.5. The relaxer is about 9 or so. And then we have to bring it back down with our neutralizing shampoo to bring it back to the acid mantle stage. And even some of the products that we use to treat the hair, if the pH is high, we have to bring it back down. So hair is not just hair that you look at and you put stuff on it and think that it will smile at you. No, it will not. You have to give hair the right things on it. You have to give hair the right products. You have to do the right things for the hair to smile back at you, for the hair to curl the way you want it to curl, for the hair to move and bounce how you want it to move. And the olive oil is good. Mix them. Steaming is excellent, because I mean, with the steaming now, what we're doing, we're opening up the follicles of the hair. That can help, especially if the hair, its scalp is tight and need to unclog. You will work with the steam, but based on the products that we put on the hair. Guys, we can move on to for thinning hair. Most of the times our hair is thin, but thinning hair is something that we definitely have to do consultation, because your hair can thin based on medication, it can thin based on hormones, it can thin based on stress, it can thin based on lack of care. Lack of care can cause your hair to just come right off your head because you're not doing the right things, you're not putting on the right products. You understand? So it is important that you get your consultations and know exactly what you're treating and why you're treating. All right. So if it is that, you know, you have your kinky coily hair and you want your curl formation to come, because if your hair is damaged, you won't get the hair curly the way you want it to curl. None at all. Because the hair is telling you that I need something, just as though we have to bathe. Because if you don't bathe for a day, or if you don't bathe for 2 days, you can't perform as much as you should, based on the fact that the hair is dirty. One, the hair needs some conditioner. The hair needs to be pliable. So guys, use the right shampoos, use the right conditioners. For fine hair, you can't use too much moisture. You can't give the hair too much moisture if the hair is excessively fine, because all you're going to be doing is weigh down the hair. And if the hair is too coarse, you can't use product that doesn't have enough moisturizing content and humectant in it. So we stick to the glycerine, we stick to the humectants. We stay away from the sulfate, we stay away from the alcohol, products with the alcohol and the sulfate, but we do need the sulfate sometimes, every now and again, because the sulfate helps to strip and get rid of the built up and grime that is present on the shaft and on the scalp sometimes. All right, understanding your hair porosity. In order for us to care for your hair, we need to know the porosity of your hair. So we need to check your hair's porosity. So the porosity of the hair can be low, it can be high, and it can be normal. And that's when, you know, your cuticle scales are not raised. If your cuticle scales are raised, you know, it's open, everything can just go right into that cuticle scale. With the if the cuticle scales are closed, then nothing can go into, no moisture. It takes a lot longer time for the moisture to penetrate into that hair. So whatever treatments we're going to deposit, we would now have to lift the cuticle scale somewhat for the moisture or the products to penetrate the cuticle scales. And if the cuticle scales are not being penetrated, then the product is not working. The product is not doing anything. So we now have to consult, do the adjustment of the porosity level of the hair, and then do our treatments. Slide, next slide. All right, so a lot of persons are walking around with traction alopecia. What causes traction alopecia is tension, hairstyles that pull tight, like your braids, your ponytails, your cornrows, your tie twists, the wigs. Persons are wearing wigs these days and gluing down the wig on the hairline. A lot of persons are coming into us now with the hairline gone because they pull off the wig and the ear pull out everything. No, we don't want that to happen. Yes, you can change your hairstyles. Yes, you can look different, but again, moderation. You can braid your hair, but moderation, not consistently braiding and then braiding it tight. We can't braid the hair tight, or you can't braid it tight any at all, because then you're going to end up with traction alopecia. And as women, we don't want to walk around with our hair looking the way this hair is looking right now, because it is, especially it's the front of our hair. No, if the follicles are not closed, if the follicles are not closed, then the hair will have a chance to grow back. If you give the hair attention, immediately it will grow back. But if you don't give that hair attention and you're consistently putting in those braids, then you will have scar tissues. And once the tissues are scarred, then your hair won't grow back any at all, based on the fact that the tissues are scarred. So I will stress it, I will emphasize, please, moderation, less braids, less braids, less braids. Wear your braids, not for too long, remove them, shampoo them. Here, bacteria grows in cool, dark area. So when you wear those wigs, when you're constantly having the braids, the scalp is not able to breathe, the scalp not getting any sunlight. Remember, sunlight is important. Your vitamin D is important for the scalp, not just the body, but it is important for the scalp as well. We need that sunlight. So I'll emphasize comprehensive skin, hair, and scalp care, tailoring routines to individual needs, remembering the importance of consistent hair care. You need to focus on, I wouldn't just say hair care, but self-care, and self-care entails beautiful hair, beautiful skin, beautiful nails. Please to take care of your hair and your skin. It is what God gives us for our beauty to shine with. And if we don't take care of it, it will take care of us. And as the saying goes, if you don't prepare for life, life will prepare for you. So if you don't prepare to take care of your hair and your skin, then whatever your hair and your skin give you, that is what you have to sit with and then move over, guys. And that's the end of my presentation. I thank you.
Okay, guys, again, open your mics and give our presenter some appreciation for a job well done. I'm sure this was a lot of information that will benefit a lot of people. I was paying attention, and I'll comment later on what I learned and how I'll implement some of them. We're going to move right into the second presentation. And at the end of the next presentation, you'll be asked to pose your questions to both speakers. So our next presenter is a friend of mine for over 20 years. it's wonderful when you can say you have friends for that long. And I speak of Dr. Marsha Barnett, who has been a physician for over 20 years. She's a graduate of University of the West Indies, class of 2002, my class. And Dr. Barnett pursued, after completing her medical studies, specialist training in dermatology. As a dermatology resident at the UWI hospital, she graduated with a degree in clinical dermatology from the Queen Mary University of London. She is very experienced in managing dermatology problems and has a background of having performed numerous in-office surgical and non-surgical procedures. She also went on to do her postgraduate training in dermoscopy with the University of London. And this has given a remarkable amount of skills in skin cancer surveillance, mapping, and surgery. Over the past 10 years, Dr. Barnett trained with the American Academy of Aesthetic Medicine, where she has honed her skills to become an aesthetic physician. As an aesthetic physician, she does a number of procedures, including Botox, dermal fillers, laser treatments, microdermabrasion, chemical peels, just to name a few. Her extensive training in dermatology has not prevented her from maintaining her skills as a general practitioner, which she absolutely loves to do. She is particularly passionate about chronic disease management. Dr. Barnett has worked as a medical correspondent for television and radio, both in Jamaica and overseas, and presently she is a columnist for the TCI Sun, a local newspaper in Turks and Caicos, where she now resides and works. Dr. Marsha Barnett, like myself, is a fitness enthusiast, and despite her busy schedule, she takes time to attend to her physical and her social health. She has a very active social life, for which I envy her greatly. Dr. Barnett is not just brainy, she is a former Miss Jamaica Festival queen, and thus has earned and keeps her title of B&B, which is Beauty and Brains. I am pleased to introduce to you my friend and colleague for over 20 years, Dr. Marsha Barnett. I will turn over to her now. Dr. Barnett.
Hi, Orlando. Thank you so much for having me. Hello. Awesome. Are you able to hear me now or no?
Clearly.
Okay, perfect. So let me share my screen with you. Let me know when you're seeing my screen. Are you seeing my screen?
Not yet.
No? Hold on. Share screen. 1 second. Let me close that. Hold on. Something might unmute. Oh shoot. Share. I want to share my entire screen.
I'm gonna also try.
Okay.
On my side.
Let me see something. Let me Are you seeing me?
No, not yet.
Okay, let me try something. Okay. Okay, maybe if you show the video, if you show it, maybe that will work. Because I can't even find you anymore on this.
I'm trying to set up so I can share, but my computer is a little slow today for some reason. Internet is a little slow where I am. Just bear with us, guys. We're just trying to sort this out. Just give us a minute.
At the time. Select a tab to share.
Yes, select the one where the presentation is on.
Share. Share system. Let me see if it's going to send it to you now. No.
We're not seeing it yet.
It's not working. It's not allowing me to share my screen with you at all. Can you
Right, so you're gonna have to make me back host. While you just start talking, I'll get the slides up as soon as I can. So make me back host.
Hold on a second.
Doc, you gotta go to the participants area and just hover over my name. Can you see my name until you see those three little buttons, or go to the end of where my name is, where you see the microphone and so on. The little buttons come up, you press on it and then you can make me host from there.
I'm looking for you. Host me. Let me search for your name.
Yeah.
Okay, perfect.
See those little buttons, you can make me host.
Yeah, man, I see it now. Make host. Awesome.
All right, so you can go ahead. I'm gonna try to get the slides up as soon as I can. I'm trying to upload it.
In the meantime, Dr. Thomas, can you let me in, please?
Let who in?
Trisha, I'm trying to get in on another gadget, but
Okay, in a sec, okay. All right, Dr. Barnett, is it possible for you to go ahead until I get this downloaded? Because it's
okay, sure.
Yeah.
Okay.
Yeah.
Are you able to see me? Or no, I'm not seeing myself. I'm not sure if you can see me. Can you hear me clearly now?
Can
Yes?
hear you, Dr. Barnett, but we're not seeing you, but we're hearing you.
Okay, awesome. Okay. Start video. I just saw myself before, but I'm not getting to start my video, Orlando. I think I was blocked from doing my video, but I can start without it, and then we can fix that in the interim. That's not a problem, I hope. Okay, so I'm going to be speaking a little bit about diet and supplements for the perfect skin. And firstly, for me, what is perfect skin? Perfect skin means different things to different persons, but for us in skin and in medicine and in dermatology, what we tend to look at is clarity of the skin. Does somebody have any active conditions that are very obvious when you look at them? So can you look at somebody's face and see this person obviously has acne or this person obviously has eczema? What about the pigmentation? Is the person lighter than they should naturally be because maybe they're bleaching the skin? Or do they look darker because they're in the sun a lot and they're hyperpigmented? Do you have blemishes and dark spots? Do you have sunspots? And also, what's the texture of the skin? Is it nice and supple? Does it look too dry? And even age of the person, when you're looking at the person, what do you perceive the age of the individual to be? Are we thinking this person is about the age that they really say they are? Or are we thinking they may be 5 or 10 years younger, which would be awesome, or 5 or 10 years older, which we're trying not to have as our reality? So a big part of this group is really about using your lifestyle to improve your life and to improve your health. And the skin, like all other organs, is affected by what we eat and what we do, and if we exercise, and our stress levels, and our sleep, and so on. But the first slide I had said, we are what we eat. And on that photo, I had a wide range of different foods and different fruits and vegetables, really. And almost every presentation that I do that has to do with lifestyle or wellness, I always start off talking about fruits and vegetables, because fruits and vegetables are really where we get most of our antioxidants from. I know this group of persons are very, very, very aware of what antioxidants are, but basically we get what is called oxidative stress, basically, wear and tear because of the sun, because of things that are in foods, because of medications we may be on, and we need things in our body to fight against this. And this is why antioxidants are so important. In fact, even we probably do know that many of us on a regular basis, we're making even cancer cells, and our immune system allows us to get rid of those cancer cells, and that is how we remain well, because of the fact that your immune system is working well and we have antioxidants. And when it comes on to diet, to be honest, even in medicine, we don't know everything when it comes on to diet and food and nutrition. But what we do know is that different fruits give different uh, nutrients, right? So we know we have vitamin A and B and C, and we know we should probably be having around 5 servings of fruits and vegetables per day. Awesome if you can get to 5 to 7, but definitely above 3. But what we also need to remember is that it's not just the number of fruits and vegetables that we're having, but it's also the range. So we're not trying to become nutritionists, but basically, if you're what studies have shown is if somebody has 5 servings of fruits and vegetables, but all you eat every day, for instance, is lettuce, tomatoes, and carrots, then the level of antioxidants and the range of antioxidants and how well your body is able to fight oxidative stress is not as great as somebody who has multiple fruits, multiple fruits and vegetables. So it's very important for us to have a variety of foods, because it is going to affect the health in general, but the skin as well. And when I say we don't have to be nutritionists, basically nature has made it so simple that many of the things that have the same colors have similar nutrients. So many of the things that are orange having vitamin A, you're going to have
to do your cruciferous vegetables like broccoli and so on. And then you put in your purple, your nightshade vegetables, your tomatoes, and the red ones would have an oxalic acid. So what you want is a wide variety of colors on your plate on a daily and weekly and monthly basis. The next thing on that list was water intake. We all know that water is a big part of our
Slides are not up, Doc.
bodies.
The slides are not up, Doc.
Oh yeah, perfect. Thank you. I'm seeing it, but I don't think they can see me. I'm not sure why. I'm not sure what's happening there. But I'm hoping they can still follow what I'm saying. So water is very important because water is a part of all chemical activities that happen in the body. But also, if you're not drinking enough fluids, not drinking enough water, you're more likely to become dehydrated. Especially in a time like now, we're doing record heat all over in the world, record temperatures, and Jamaica is hot all the time. If you're in the Caribbean any at all, it tends to be hot all the time. We had somebody on the feed in Florida, tends to be hot most of the time. So being hydrated is very important because in the same way the body becomes dehydrated, the skin becomes dehydrated as well. And then the skin becomes dry, it becomes brittle. You start to look as if you're getting older. If you have things like eczema, that can also tend to flare. So keeping your fluid intake high, especially during hot climates, is important. And the last thing I have on this first slide is to choose simple foods. When I say simple foods, I mean, if you can have the tomato, why have the ketchup, for instance? If you can have the potato out of the ground and have it baked or broiled, why have it processed and have it as potato chips? Anything that you can have in its most natural state is always better for you overall, and it is also better for the skin, and you will see in the other slides. If you can have rice as it is naturally, why go and get rice that is bleached and processed one? So we're basically trying to have foods in its most natural state. The next slide speaks about omega-3s. This is probably my favorite supplement, but also my favorite thing in diet because it's one of the first things we started to really look at as medical physicians. Because persons, of course, would say, you know, when you eat certain things, we'll talk about ginger and turmeric and cayenne. But during medical school, years ago, one of the first things that we started to really investigate and look at medical studies and looking at thousands of people was really the role of omega-3 in general health. And it has been proven over years that it is a very good thing for us in general. Omega-3s are anti-inflammatory, but they're present in most of the membranes in the body and in the brain, including the skin. Omega-3s are basically like oils, specific like healthy oils. And oils do what? They moisturize. In the same way you may put an oil on the hair, you may put an oil on the skin, you may put on a lotion. You're using omega-3s, you're basically getting moisture or lubrication from the inside out for the skin. So sometimes when a patient has very dry skin, or if a parent, for instance, has a child and the child has eczema, and they ask, what can I do for to improve my skin? I will always say to them, you can start improving your diet by increasing your intake of omega-3s, because that will help the suppleness of the skin. Because of the fact that dry skin tends to age more quickly, which is why when you go into any kind of beauty store, you're going to be seeing a myriad of moisturizers as anti-agers. That is another reason why omega-3s are good anti-aging property, have good anti-aging properties, because of the fact that they moisturize basically from the inside out. And like I was saying before, omega-3s have numerous health benefits. They're generally anti-inflammatory, they're good for the health, they increase good cholesterol, they're good for the joints, so persons who have arthritis and so on. That's a good thing. And if you don't want to necessarily take a supplement, then having it in your diet many times, in my opinion, is even better than taking a supplement. Because remember, we're trying to go with the simplest thing. So things like salmon, sardines, herring, and so on, perfect. Eggs, great. But you do not have to be somebody who is even eating oysters or having a lot of meats. You can get it also from things like walnuts and spinach. And if we go to the next line, you could see where I spoke about even somebody who is vegetarian can go get these through things like edamame, from things like flaxseed and walnuts and spinach and so on. So it's very important, in my opinion, to have lots of omega-3 in the diet, especially as we're getting older, because it's not just the skin that's getting older, but we generally are getting a little older as well. You can move on. Okay, so dairy. Many persons have a lot of dairy in their diet, myself included. I tell persons, I mean, from I was born, I think every day I've had milk. But this does not work for everybody. We have actually found, for one, many people know dairy can flare eczema for a lot of persons. So if you or your child or your family member has eczema, it does not necessarily mean that the person is going to get a worsening of their skin when they have dairy, but it is definitely something to look out for, because dairy has a negative impact on lots of person's skin. And another thing that dairy does that we found out just recently is that for many persons, dairy can actually flare acne as well. So before we'd even think that acne is going to be flared mainly from oils and so on, but now we're finding that acne flares mainly from dairy and from lots of sugars and carbohydrates. Now, I don't want persons to be of the opinion that if you take dairy out of your diet and you take carbohydrates and you have very acne, for instance, it's going to clear. I'm not saying that, but what I'm saying is for a percentage of the population, around 10 to 20% of the population, when they have lots of dairy, they will notice a flaring in their skin. So we have to be smart about it. If you're having dairy and your eczema is getting worse, you have to stop that, because it's going to stop you from having that perfect skin that we're trying to achieve. Carbohydrates, in the same way I love omega-3s, I probably dislike carbohydrates. And the reason for that is that it is packed of many things which are not good for us. It's packed of sugar, it's packed of probably oils, many of them are processed, so we're eating things we don't really know what is in them. And it's also proven to be very negative for the skin overall. So I spoke about acne, and one of the things we found is that when you have a lot of sugars, your body produces insulin. And when you produce insulin, there's a particular insulin growth factor, which is kind of a receptor unlike the oil glands. And what that does is that it causes an overstimulation of the oil glands, like on the face, which causes a blockage of the pores. That's how you get in some acne. That's how you get in open pores. That's how you get in the pustules and the blackheads and the whiteheads, many times because of the diet. But importantly as well, sugars and these processed carbohydrates have another big negative, in that it tends to break down collagen and it tends to break down elastin in the skin. And we need collagen and we need elastin in the skin to maintain our youthful appearance. So this photo basically shows, you have seen what the skin looks like from the previous presenter. This is a simpler photo because I'm trying to focus on a specific thing, which is really aging. On the left, well, both of them you can see on the top is the epidermis. You met this about half an hour ago. And then we have the dermis, and then we have fat and muscle. And you can see the person, or on the left-hand side, there is a lot of blue and a lot of white, and you can see the collagen and so on. And that's what the skin looks like when we're 5 and 10 and 20 and 25 and sometimes even 30. But by the time we get to 40 and 45 and 50, we start to lose some of our collagen. And even the collagen that is there, you can see some of it looks broken, some of it isn't crisscrossed as it should be. And we have less hyaluronic acid in the skin, and we're losing some elastin in the skin as well. And this happens naturally as we get older, but there's some things that we do that can speed that up, like having lots of sugars in our diets, having lots of processed foods in our diets. Smoking too tends to break down collagen and elastin. And so these things are important when it comes on to lifestyle, not just what we're eating, but also supplementation. So one of the things, because we understand that when we're losing the collagen and we're losing the elastin, you can see that central part of the photo is shrunken, and that's how we're getting the wrinkles on the top that we are seeing with the naked eye. So because of that, we decided perhaps if we give patients collagen, their skin will improve. And then collagen came on the market, and some persons on speed collagen tablets or collagen solutions or powders or peptides. But the thought of that is that we're trying to put back some of the collagen that has been lost. And initially, when these collagen supplements became very popular, many persons in medicine and in dermatology did not really suggest it to patients because we were not really sure if it had any true benefits. Because you take something orally, it doesn't mean it's going to sit in the skin, if you understand what I'm saying. But what we have found now, because it has been very popular for a few years, is that it does help. When we look at photos of persons before they started and a few years after, we see improvement in the skin. Because remember, the skin isn't just the tone, but it's also the turgor, the thickness. How much does it bounce back? Is it wrinkly? Or does it have nice collagen and elastin underneath it? Does it have that thick layer? And collagen, we have found, does help. Even when you're taking it orally, it does help to build back the collagen underneath the skin. Now, these are things that we're doing all together, not by itself, but collagen does make a difference. Collagen makes a difference for other things as well. So we see that number 2, it says it improves the appearance of the hair and nails, but it also helps with joint health because we use collagen for joints. It helps with our heart, helps with our bone. So it is something that a lot of patients go on now because it does help with the skin overall, trying to get that perfect skin, but also a youth appearance. Now, I can't be a dermatologist and not say anything at all about sun damage and damage. The sun is the number 1 agent of the skin. It affects collagen and elastin, but it also affects pigmentation. We all know because when we go in the sun, we get darker, and that is in a way a sign of photo damage. And as we get older, into our 50s and 60s, many persons, the entire face looks darker than it did when they were in their 30s and 40s. And that is actually a sign of aging in black skin. In lighter persons, it causes a lot of brown spots. For darker persons, sometimes you get the little white spots on the legs and on the arms. Patients will come in and ask me, what is this? This is pigmentation from sun damage. And of course, we all know that sun leads to DNA damage and skin cancer. But why have I chosen this photo for that? I've chosen this photo because this gentleman, you notice one side of the face look young and one side of the face look old, because he's a driver in the UK for over 27, 28 years. And that's the side that he drives on. He never wears sunscreen. It's not tinted. The windows are down and you can see obvious photo aging. But if you don't want to believe this photo, what I would say to you, if you have someone in your family who is older, who is say 70 years old, say look at the face and look at the tummy and the legs, and you will realize that the thighs and the tummy look young, but the face is where you see in the age. The only difference is the sun damage. So that is why photo protection is so important. On this, I had a photo of a fern. I'm not sure what happened with it when it was downloaded, but I'm going to tell you something that most people probably don't know. Most doctors don't know. There's a fern in Central South America, and it has been found to work as a sunscreen, and it is available in capsules. It's from something called Polypodium leucomotus, so you can look at that if you're really interested in sun protection of the skin. If you're getting a lot of dark spots, a lot of dyspigmentation, if you know somebody who has any kind of photosensitive condition. So this doesn't even have to be a skin thing. This can be for somebody who has lupus or any type of sun sensitive condition. Many times we have the patients using their topical sunscreen, which they still would. But if they want to live a life where they want to go to the beach or the pool, I would normally tell them to add that as a protective layer, not only for their health, but also for the skin. Because as you saw in that photo, the sun is really the number 1 agent of the skin. So that's a supplement that will help us to ensure we have perfect skin or near to perfect skin. Okay. With gluten, I apologize for this. Every page had a photo on it. So I'm not sure, I think it's download. But everybody, well, not everybody, but if you watch, when I'm on Instagram, looking on feeds from Jamaica, I see some spas and salons doing glutathione. And we have spas and salons where I live that sell glutathione soaps. And in Korea and that part of the world, glutathione tablets and soaps and so on are very popular. It's pushed mainly for skin lightening and skin brightening. But the truth of the matter is that although many persons will take it as a supplement orally, it's not very effective when taken orally. So if someone is going to be looking at that to improve, like the fade dark spots and fade the skin, and not necessarily have a lighter complexion, but a brighter complexion, to be honest, it's really found to be most effective using IV. Our body produces glutathione. We use it to detoxify a lot of stuff. The liver needs glutathione all the time. And as we get older, like many other things, our level of glutathione tends to reduce. There are some things we can do in our diet, like having turmeric, whey protein, lots of vitamin C, exercising, and reducing alcohol, which has been proven to increase the glutathione effects. But the truth is, taking the tablets is not going to be anywhere near as effective as doing an IV. And that's one of the reasons why many derms do not necessarily push a glutathione supplementation, or even the creams, they don't tend to lighten as much because it's not as bioavailable as IV. Next one, Orlando. Okay, so I'm going to go into vitamins. I'm going to do A, B, C, D, and E. And the first one I'm going to look at is vitamin A. And vitamin A is very important. It aids in collagen production, it improves overall cell turnover, and so therefore it is anti-aging. As an effect, it helps to reduce fine lines and wrinkles, and it improves skin clarity. But what is important is this: vitamin A, everybody knows vitamin A. If you have cable TV, you're going to see ads, and they're going to talk about retinols. Retinols are vitamin A's, and retinols are sold everywhere. You put it on the skin, it's supposed to moisturize, it's supposed to help with fine lines and wrinkles. There isn't a day that passes that if you're seeing patients with acne, you wouldn't write a prescription for retin-A or differin or some type of vitamin A analog. So even this thing that is derived from a vitamin is used in medicine as a prescription. However, the practice I work at, we also have a naturopath, and she uses vitamin A under the tongue as a liquid to treat acne. But what I would say with this is that vitamin A can have toxicity. So you have to be careful if you're going to be taking it as an oral. Not normally suggest somebody takes vitamin A by itself, unless they're seeing a doctor or they're seeing a naturopath. If it's in a supplement, fine. But to take large amounts of vitamin A, trying to clear acne or something, I would not suggest that because of the fact that it can have certain side effects. But using it as a topical, like a retinol or a retin-A prescription, is perfect for anti-aging. It is the most commonly used vitamin or vitamin derivative in skincare because we use it so much for so many things. The next vitamin I had was vitamin B. And vitamin B, you have a number of vitamin Bs. You have like 8 vitamin Bs, but we use niacinamide a lot to protect the skin. And we also use something called PABA for UV rays. Now, on the photo that is missing, what I had on the photo was biotin. Biotin is a vitamin B as well. And a lot of people use biotin for hair and for hair restoration, and it is helpful. But usually I say to persons when they're going to do that, it's probably better to do it in like a multivitamin. Or if you're going to use biotin, sometimes more is not better. Follow what is on the bottle. Do not overdose with biotin either. Just stick to the recommended doses. But biotin has been proven in many studies to help with brittle nails, causes the nails to grow back thicker, plus of course calcium, which you can get in milk and cheese, but we can get as supplements as well. And it helps the shaft of the hair to grow back thicker for many persons. So vitamin Bs are great. Different vitamin Bs do different things. Some help with nails, some help with the hair, some help with pigmentation. We even use certain vitamin Bs to help with the management of acne. Vitamin C is very important as well. We all know vitamin C is found in citrus fruits and so on. So that is how your diet comes in. But we can also supplement with vitamin C. Vitamin C tends to help glutathione to be absorbed better. Vitamin C is necessary to make collagen. So many persons will take vitamin C with their collagen because vitamin C plays a lot of different roles in the body for anti-aging. Vitamin C topically is a skin brightener as well. So many persons will use vitamin C on the skin as a skin brightener. And vitamin C as an on the skin is also an antioxidant. So when I have a patient and they are concerned about pigmentation, many times I will have them use a vitamin C serum and then add a sunscreen on top of it, because that is proven to help with the antioxidant effect of the sunscreen itself. So they're getting less of the damage from the photo rays. Vitamin D is thought to be beneficial in acne and a condition called rosacea, and E is a very good moisturizer. Zinc is something too that we have started to use in medicine because it supports collagen. It also can be used to treat acne, both oral zinc, but also we have topical zinc preparations. But the thing is that most of the multivitamins that are specifically for hair, skin, and nails, or Perfectil, or any of those brands, tend to have a good combination of all of them together. Go forward for me a little. Perfect. Okay, so you heard a lot about aloe vera, using it topically on the skin. Jamaicans, I find we really love aloe vera, or probably more people specific to Jamaicans. And aloe vera gel works very well for sunburns. We use it a lot in medicine, and we use it to moisturize the skin. Moist skin doesn't tend to itch as much. Patients who have eczema will probably know that we use a lot of moisturizers. So it does have a role in managing eczema and even wounds as a topical. What I learned today in preparing for this presentation is that medical studies have actually shown that using it orally can help to improve elasticity and collagen production. So as a child, I was forced to have this. You know, you're having it as a washout, or you're having it for improved general health, but it is now proven that this does help the skin as well, which is not something that we usually think about in medicine. As a Jamaican doctor, obviously, you know we use aloe vera for a lot of things, and you see it helps patients, but you don't normally see it proven in studies. And studies are now showing that it does have great benefits that we probably didn't even think of it having. And the next thing I put up was apple cider vinegar. So apple cider vinegar, most people use apple cider vinegar for weight loss. But we do know that many persons use it as an antifungal, topically on the skin, and antibacterial, topically on the skin. And this is basically showing you what is proven to really work and what not so much. So it is there's definitely strong evidence that it's an antioxidant, which you know is anti-aging, and that it reduces bacteria. Many people take it for weight loss and to regulate their blood sugars. It soothes eczema. And then where it says weak, it says treats dandruff and improves scalp health. But what I have found, I've had a few patients who will use it as a part of their hair care, like when they're washing their hair. They don't leave it on too long, and then they use the regular things that their hairdresser, cosmetologist, or trichologist told them to use. But when they put that on the scalp, I found a few patients, it does help with their seborrheic dermatitis and with their seb eczemas. Taking it orally, many persons take that for weight loss, and that does help some people. It cuts their appetite and so on. It gives some people slightly clearer skin as well. So I could not leave without saying that despite all of what we're talking about when it comes down to lots of vitamins and vitamins A, B, C, E, and your omega-3s and your fish oils and all of these things, that you still have to know when to seek professional help. Because, for instance, a point was made by the previous speaker that their iron deficiency, for instance, can cause hair loss. So just because you're losing hair, if you're taking your supplements and you're not getting anywhere, you need to go in to see your doctor. It doesn't even have to be a dermatologist. Your GP is going to know, okay, she has hair loss. I need to make sure this isn't a thyroid problem. I need to make sure something else isn't happening. I need to make sure she doesn't have iron deficiency. If you have acne, it's great to eat properly, to exercise and so on. But even to use your over-the-counters, but sometimes you may need a prescription drug, or there may be an underlying medical reason for why the skin is flaring now. So basically my point is that there are many different foods, and a healthy lifestyle in general will show on your skin. And there's supplements that can be taken, but for me, it's good to work hand in hand. Right? You see a doctor for something, you can have supplements once it's okay. But if you're using your supplements and you're not getting the benefits that you're looking for, then you definitely should seek professional help. And I thank you so much for your time, and sorry for the mix up at the beginning. I hope it was okay.
All right, so that was a mouthful. We have been thoroughly fetted with skin-saving information. I did learn quite a few things, Dr. Barnett. So without further ado, we're going to open the floor after just saying thank you to our two wonderful presenters for the information shared. Let's get into the question and answer right away. Are there any questions? People who are on YouTube, type your questions in the chat. I'm monitoring it. And people here can unmute your mic one at a time, raise your hand. I see Elder has his hand up. So there is already a hand up. Go ahead, Elder Walker.
Listen, good night.
Good night.
All right. My question is, what if you're giving the right treatment for the ear, the right treatment for the body, and the ear is not doing what it ought to do? Is there a possibility they're gonna need a carrier to take the nutrient to the cells in a different way?
Who is this question for? For me or for the trichologist?
All right, the trichologist.
Okay.
The ear. I'm talking about the ear now. Let's say it could be for body, you know. Body could answer in part. You're giving the ear the right treatment, because I've seen it happen, because I do lifestyle. You're giving the ear the right treatment.
Give us an example, Elawag. Give us an example of what nutrients you're referring to, because the question is a little vague. Give a little more specific.
All right, let's say the iron, the iron not getting to the cells properly, because the person might be stressed out, the person might not relax, the person might eating too fast, and because of that, the food not doing the work that it ought to do. Is there a carrier that you can take to let the food do its job? Is there a carrier you can prepare as a doctor or as a trichologist to take the food to the cells properly in a different way that the person can be benefited?
All right, so Dr. Thomas, I think I kind of understand what he's asking, but this question is for all three of us to answer. But from my perspective, if it is that the person has an iron deficiency and she has an iron deficiency, the hair, what we are doing topically, the hair will not grow based on what we are doing topically. The person definitely have to be on iron supplements. If it is that the iron supplements are not working, then what the trichologist do, because the trichologist is not a doctor, what we do is do the consultation and refer. So from time to time, I'll refer persons to Dr. Thomas for him to do some blood tests, for them to test further to see why the client is losing hair. Because it can be hormones, it can be iron, it can be meds, it can be a lot of stuff. But if it is that we realize that the person has an iron deficiency, say, for example, when we send the client to the doctor, and it proves that the iron is extremely low, the hair will break, it definitely will break. Then we put the client on the iron supplements and then do the necessary topical treatments as well, hand in hand. If it is that it's not working, then you continue to do another test. Then the doctor now will infuse the iron into the bloodstream to kind of boost the iron some more, for it to, circulate and do what it is supposed to do. So from there, we'll watch. And if it not, that means something else, we can run further tests to see what else is happening. Dr. Thomas and dermatologist, you can assist me with that, please.
What about hormonal imbalance? if there's a hormone.
Hold on, Dr. Ella Walker. Hold on.
No,
Hold on.
he's asking if there's a hormone imbalance, what? I wasn't hearing his response. Hello?
I think he fell off. So what you probably
Oh,
can do is elaborate on the last one, the first one, and
okay, so
pick up from what I said.
Right. I mean, at the end of the day, when he said a carrier, I didn't fully understand what he meant. I didn't know if he was meaning a carrier of the product to the hair or a carrier within the body, which is why I wasn't 100% clear.
He was referring to a booster.
In the body or the cells on the
to get the nutrient to the cells, that it can help the other organs of the body, might help get the nutrient to the cells, right? Can help the skin, can help the ear, can help different things.
Okay, Ella Walker, I'm not aware of any such carrier that you're referring to. So maybe you're here to educate us. All right, maybe we'll ask him. Go ahead, Dr. Barnett.
I mean, yeah, no, what I was saying is that when it comes to hair growth, genetics has a lot to do with it. For instance, you would have the best diet ever. If it's not made for your hair to be down to your waist, it's not going to grow there. You may have nice, great, lustrous hair, but you know, genetics has a lot to do with diet, has a lot to do with it too. Sometimes hormones and stress, somebody can have what we call a mesenterogen effluvium, which is basically where the hair just starts to fall out. And that happens sometimes for a period of 3 to 6 months. And that can be from stress, from childbirth, from hormones, just because your hair cycles through different cycles. And maybe at one particular time, more of them are in that cycle than normal. Medications, like was said before, can cause that. Other hormonal issues can cause that as well. If somebody, for instance, has iron, because I'm trying to figure out the question, if somebody has, for instance, an iron deficiency anemia, then there are certain things you can do to improve their absorption of the iron, for instance, by ensuring that they have it with vitamin C and not with dairy, that kind of stuff, you know, so you can talk to the patient about and making sure it's a bioavailable iron, meaning that it's an iron where the person takes it, it is going to be absorbed in the body and not be just excreted. So there's some things we can do according to what the patient, what deficiencies they may be found to have. So for me as a carrier, it would have to be absorbed within the body and therefore have an effect throughout the body where you need it, to make sure that it is properly absorbed. That would be my answer to that.
All right, Trudian, your hand is up. Can you go ahead and ask your question now, Trudian?
Good afternoon, everyone. Good night, sorry.
Good night, Trudian.
Okay, so my question is for the dermatologist. I have a skin situation. Whenever my skin gets wet, no matter how it gets wet, bathing, sweating, it doesn't matter. I itch really, really bad. If I do something to change the temperature, say for example, I come home and I am taking off my blouse, as it comes off, I start to itch really, really bad. So because of that, I'm not able to moisturize or anything like that. I just have to try and see how best I can maintain a specific temperature. So if I am in an area that is cold, I have to try and, you know, maintain that temperature throughout the day. Because if I get really hot, I can't do any form of exercise. And because as I start to sweat, I start to itch. My skin literally burns really, really bad. You know, like somebody will pepper on you. So it's a situation that is really, really bad. However, Dr. Thomas was able to help me, temporary help, because what he gave me and it worked, you know, he took me off it for a while. So I'm wondering if there's something external that I could do, or from your standpoint, if there's anything, you know, you could recommend that I could try.
Okay, so what you're describing sounds to me as if you probably have a condition we call urticaria. That's what it sounds like to me. Whether it is that you're getting the wheals and wheals coming up or just the burning. But what would normally be happening is that your body is producing excess histamine and it's maybe causing heat and flush and burning, itching, sometimes a rash. The treatment for it, to be honest, is what we call systemic management. It's really about oral medications and sometimes injections, and also avoiding whatever the stimulant is, which is what you're doing. There is no topical that is really proven to make a big difference. For persons, for instance, who get it as a rash or swelling coming out on the skin, if you think about it, they may have it to the left arm today, to the right thigh tomorrow, to the back. So using a topical isn't going to really be effective. The treatment for it is usually things like oral antihistamines, avoiding sweating, heat. I know that's difficult. Sometimes we have to give cortisones, but we don't normally use cortisone creams as much. We tend to use like a cortisone injection if it is really bad. But we don't really have a cure for that condition that you're describing. Sometimes patients will, for instance, take the medication, and once it is effective, then they try to, maintain a relatively no. I don't know if that was the diagnosis or if that is what you were given, but
Yes,
they try
doc.
to.
She was diagnosed with urticaria and she
Okay,
didn't respond to antihistamine. She only responded to steroids, which as she said,
Okay.
I didn't want to keep her on, so I had to give her temporarily
Yeah.
and then take her off.
Okay, okay. What we could talk about other things like I would tend to use like a sedating and non-sedating antihistamine. Sometimes I do see some patients get improvements when you add a mast cell inhibitor as well, like
Okay.
montelukast. Sometimes I do see when we add that in. And then sometimes I will give prednisone, but sometimes I'll also give something like decomedrol or triamcinolone, which will work for them for a month or 6 weeks. And sometimes you can stretch out the length of time they need to be on it because it kind of numbs down their immune response. But there really is no cure. And the thought is that it's a hyperreactivity within the patient's skin. And topicals are simply not proven to work.
All right, we have a few questions from Facebook. So there is one question here. Are there any homemade products for psoriasis of the scalp? So somebody asking about natural products for psoriasis. Anything, Dr. Barney, that you could recommend apart from your aloe vera and stuff to moisturize the skin?
Homemade, not necessarily. We tend to use things that have in sulfur sometimes, coal tar, and salicylic acid. So the person can probably get these things online if they don't want to use a prescription or like on Amazon. But I wouldn't necessarily put it in a category of homemade because you need something for the scaling and you also need something for the inflammation. If, for instance, they wanted to compound something for themselves and buy like a hydrocortisone at the pharmacy and mix it with a salicylic acid they find on Amazon, they could try that. But I cannot really say that I've seen, we tend to use stronger things. If the patient, it depends on how bad it is, that may work, but not necessarily homemade. I wouldn't say yes to a homemade thing. Like I can't say, honey with oatmeal, for instance. Yeah, I can't really say that because you need something to lift the scaling and you need something for the inflammation in the area.
All right, so a couple more questions from YouTube for both presenters. This person's asking about hyperpigmentation from mosquito bites they received as a child that is on their legs. And by extension, we could talk about hyperpigmentation from acne of the face. And they're asking for recommendations for clearing up these spots. Very common recommendation that is requested in the doctor's office. What can you say? Trisha can also chip in on here because I'm sure she's seen this a lot.
When it comes down to for one, I'm going to assume that the person's reaction to the mosquito bites no longer exists. Sometimes persons will come in for spots to the face for acne or spots to their legs, say for mosquito bites, and they still have active disease, but they are more focused on the spots. So I tend to do, say on the legs, I would tend to do 3-prong. One, we try to avoid being bitten by for instance, using repellents. And the cool thing is that you don't necessarily have to use the chemicals, because we have found that lemon and eucalyptus oil extract mixed in your lotion or put directly on the skin for persons who can manage that does work as a good like a good repellent. So if you have kids who are responding in that way, you can also add that to the lotion. We use cortisone cream sometimes if they have the bumps. And when it comes on to spots, I tend to use prescriptions a lot. But as a over the counter, the person could probably try something with, say, some kojic acid, something with tranexamic acid in it as well. They can put serums on the skin. That's what I would normally suggest. Usually if we see the patient, we would tend to give them a prescription. And sometimes we cycle like a hydroquinone or something like that. But when it comes on to doing something that you can just get over the counter, I would not. We do like chemical peels as well to the legs. And a chemical peel is going to cause the skin to peel and strip, and then you're going to have lighter, smoother skin underneath it. You could try to do, I never really advocate for patients to try to do chemical peels on their own. But if you're using like a light acid cream, like a kojic acid, then that could help to lighten it as well in the long term.
Okay, so Trisha, could you chip in with some recommendations for spots on the face? Maybe what makeup they should use to cover them and so on.
Yes, I would go with doctor, because nothing from home, no home regimen will help with the pigmentations. But as she said, we normally recommend the microdermabrasions and some light peels in between and serums to take home. So like the vitamin C and the hyaluronic acid, and even the glycolic acid is not bad, or like a 2% salicylic acid. So not everything one time, either or either. So the client will use that as a take-home product. And then they come in for the dermabrasions or the peel.
Yes. No, definitely. And the thing about it is that pigmentation is very difficult to treat.
Right.
Especially
and it depends on the skin
pigmented.
type as well.
Because even when I do, say, medical grade peels in the clinic, I have to make it clear to the patient that many times one peel alone is not going to lift all pigmentation. So sometimes a patient has to return for peels and other procedures and then have at home things that they're doing. But many of the things at home are dispensed in the clinic or sometimes prescription. Usually the things over the counter are not going to be very effective. But they can try the glycolic or kojic acid. They can get that over the counter. But if you really want to move pigment, it's usually prescription stuff and procedures.
All right, so Annette Walker has her hand up. Annette, finally, it's your time to ask your question.
Okay. Usually when I walk, I find that my skin itch, or when I'm on the treadmill. If I walk for a while, or when I'm on the treadmill, could you tell me what could I do to prevent that?
Is it that you get it when you're sweating a lot? Okay, if you're going to a hot climate, or if you're not on the treadmill but doing some other type of exercise and sweating, is that when you get the same sensation?
Yes, especially when I walk, it itches a whole lot, especially my feet.
Well, you sound as if you kind of have you sound as if you have a similar diagnosis to the lady before.
Go further from the mic, doc. We're not hearing it clearly.
Oh, I'm saying she sounds as if she has a similar diagnosis to the lady you were seeing in your office, where she has some form of urticaria. You can have it from heat, you can have it from cold, you can have it from pressure. If it's mainly on the feet and you're running, it could also be a pressure urticaria, and some people have more than one type. The only thing I would normally do in that case would be to start off with like an antihistamine. So I would tell the patient to take something like an Allegro or Claritin or Zyrtec, maybe an hour, 2 hours before they work out, and see the effect that it has. And if it is somebody, like I had a patient who was a soldier who had this condition, and you can understand how difficult it would be for a soldier to not work out. They have to exercise, it's a part of their job. So he had to be on antihistamines basically every day so that he could function. If you'd only get it when you're working out, you could take it on the days of your exercise. But just like the other lady I was speaking to, who is Dr. Thomas's patient, there is really no topical that I could suggest, and it really is usually oral medications or sometimes injections. And avoiding what is causing it, but I would never tell you to avoid exercise. So I would normally tell patients to try to stay.
I try to avoid exercise because of the
Right.
itching on the leg.
Have you ever treated it though? Have you ever taken anything for itching?
No.
Right, so that's what I'm saying. You could try to take something like a leg or Zyrtec. If you have it on the legs only, then that is one of the although we don't normally use creams for it, you could try hydrocortisone on it if it's only on the legs. Most patients get it all over the body. So creams are not normally effective. But to be honest, I would suggest an antihistamine before you work out. At least 2 hours before you work out. That's what I would suggest. And then if it itches, you could start off with a cortisone cream. And then, of course, if those two things are not doing it, because that's what you can get over the counter, then you may have to see a physician for additional help.
All right, so we have Joan. Quick question, Joan. You were very late. I don't know where you were. Church hold you up. So Joan, go ahead, unmute and ask a question quickly.
Dr. Thomas, I wasn't late. I wasn't late. I just got kicked off and joined. I'm here from 7. Anyway, good night. My first question is for Trisha. I have 2 questions, one for Trisha and one for the Derma. Trisha, your presentation has opened my eyes regarding my hair. I stopped doing processing in 2004 because whenever time I go to the hairdresser, I always get burned. As soon as the product is used, it literally burned. Then I realized that it was because of the thyroid issues that I had. So after removing the thyroid, it becomes a little easier, but I did not go back to the processing. Now, what I want to know, because in Jamaica, most of us, when we enter a salon for a shampoo or even to process a hair, the question is not asked, what type of hair do you have? And here you're saying now on the presentation that we have different types of hair, right? But it's like what goes for everybody goes for all. You go for a shampoo. The first thing that they do is put on the color thing, and then they start to apply the shampoo to your hair. So are you saying to us that it's best for us to do a consultation first to find out what type of hair do we have? Because as I said before, when you go into a salon.
So Joan, in anything you do, once the person is going to touch your hair, your skin, a doctor, a consultation is first and foremost. Even if the customer is a regular customer of mine, the client would have been out of my chair for 2 weeks or 6 weeks. The client could have been doing anything during that 6 weeks while she was not in my chair. I now have to look at the client's hair, see what is happening, how is the scalp, how the shaft feel. Then I can proceed with a shampoo or a relaxer or whatever else. Because the client can come to me for a relaxer, but the client really, I cannot do a relaxer because the hair is damaged. Or one, the scalp has some eczema on it, or the scalp is experiencing something different is going on. So anything you do, you have to do a consultation first. Anywhere you go, you need to do a consultation before you touch the client, before you start or proceed with the client. Okay, and sometimes you mentioned about the relaxer. Relaxer wasn't designed to irritate the scalp. Relaxer was designed to straighten the hair. A lot of times we relax scalp and not hair. So like for us, Shades of Elegance, we don't experience that type of burning where people are going to burn and run to the base. No, because you have to base the scalp. Just as though you protect the hands by wearing a gloves, you have to protect the client's scalp. A lot of persons do not base the scalp thoroughly before applying the chemical. So that is, you have to do a consultation to do the shampoo. Some clients too, their hair is experiencing difficulties in terms of dryness, the hair brittle. You can't put on a shampoo like that. You have to use a moisturizing shampoo or a moisturizing shampoo or a hydrating shampoo or a clarifying shampoo, because the client's scalp may need to be hydrated, it may need to clean. The client may come in for a shampoo and we have to clean the scalp. We can't proceed with the shampoo. We have to clean the scalp. You understand?
Yes.
So you have to do a consultation before any service at all.
Thank you. My
You're
next
welcome.
question is for the derma. A couple of years ago, I noticed that I had a little small spot on my right leg, almost down to the ankle. It started smaller than a little pea, and it started with some little itching. So I didn't pay any mind. I know it was there, but didn't really pay it any mind. And then it started to get bigger. So I went to my doctor, Dr. Thomas, of course, and you know, at first he thought it was nothing, probably just like a little allergy or something. And then it started to itch more. He sent me to a derma, and the derma said it was eczema. No, what I did, I cut the milk and started to avoid things that would do the itching. It still started to grow and more itching. And the spot, it's a bit rough. It's different from the texture of my skin. So I went back to Dr. Thomas and I said, listen, something is wrong. Derma had given me a cream, no help. I said, something is wrong. Send me to do an ultrasound. I went to do the ultrasound, and well, she said also it was eczema, but they saw where some little fine, I didn't even remember what she said, like vein was there, and she recommend a cream and one of those stocking thing. I did buy the stocking, I used the cream, but I don't think it has grown any further, but from time to time, I still get the itching and the spot is still there. It's not lack of exercise because I exercise like 5 days a week. I do like 3 miles walking per day. So I still don't know what is happening, but I don't like the feel of it. So any suggestions?
Okay, so let me ask you something. When you say the cream did not work, do you mean that the rash improved, but then it came back? Do you mean that you used the cream and you saw no improvement at all?
No
When you
improvement.
say the cream,
No improvement. The only time I get a bit of relief from it is when I use the aloe vera from home.
okay, I haven't seen it, but it honestly sounded to me from it started, it sounded to me like a patch eczema. And it probably is a patch eczema because you saw 3 physicians who thought it was a patch eczema, right? You say Orlando said it was probably an allergy. The derm said it looks like a eczema. You went to somebody else who said they see a little bit of venous insufficiency, but they're seeing an eczema on top of the skin as well. So it does sound like it is an eczema. One of the things is that sometimes when we see patients, we have to manage your expectations, because the honest to God truth is that we cannot cure everything in medicine, and eczema is one of the things that for many patients we're not able to cure or totally eradicate the problem. So for many persons who have eczema, you said you took out milk and that kind of stuff. Not everybody who has eczema flares because of milk and cheese and dust and cat dander and dog dander. You would have to see if that is the truth in you. Even sometimes doing an allergy test isn't necessarily going to give you an answer, right? And then we would normally treat with creams. I'm not sure which cream you were given, but if the cream isn't working, we would tend to give the patient something that may be a little stronger and a little more effective. And when I was doing medicine and dermatology, the thought was that if you have a patient who has eczema, you treat them. When the skin has cleared, they come off of the medication. And when the rash is coming back, because it almost always does, they would use the cream again. Now, the thought is that if the patient has a particular area that is always inflamed, you basically have that patient on the cream more than not. But instead of having to be on the cream 2 times a day or 1 time a day. Maybe you have them using it every other day, because it is an inflammatory process within the skin itself for most persons with eczema. So my opinion is that you could look at the creams that you were given, or Lana could review you, look at the creams you were given, probably give you something that may be a little more effective, a little stronger, but suitable for the area that is being treated. And you would have to understand that sometimes we're not able to cure eczemas. And despite the best lifestyle and all of the, taking out anything that you think may be contributing to it, you may sometimes just have to use the creams from time to time. But I don't see why your eczema should not be able to be cleared on a strong enough cream. So I think it just may be the strength of the cream. The thing about it too is if you have eczema for a long time and it's itching and so on, then the skin can become thickened, it can become raised, it can become rough as a response in the skin for that friction. So we'd want, if you're itching the area, for you to stop doing that as well. But I would really stick with the creams, but probably give you something that's stronger than what you were given before.
Thank you.
You're welcome, darling.
We do have a few questions in Zoom chat. So this question would be for Dr. Marshall. Dr. Marshall, someone is asking, is it possible for someone to be allergic to aloe vera?
Yeah. And
Yes,
Doc,
it
before
is.
you answer, we're out of time, so I want you to give like some one-sentence answer. Please, there are a number of questions.
Sorry, yes it is. That was my answer. Yes it is.
Okay, all right.
Yeah, it is. You can be allergic to anything. You have people who are allergic to pineapple. You have people who eat have nuts and they will die, for instance. Cherries, grapes, you can be allergic to strawberries. So yes, you definitely can be allergic to aloe.
What recommendations do you have for very sensitive scalp that burns when washing mildly with gentle soap? Patricia, quick, one sentence, Trisha, or 2 sentences at most. Right, Trisha.
Yeah, repeat the question for me.
What recommendations
please.
do you have for a sensitive scalp that burns when washing mildly with gentle soap? So you're washing with a milder shampoo and it still have very burning.
Then we definitely have to look at the scalp underneath the scope. We need to look at the scalp under the microscope because that scalp is inflamed. But then we need to know why the scalp is inflamed. So it could be that the client is going through some hormonal changes as well as medication, because some medication is make the scalp or the skin very sensitive. So that is something that I've never experienced that before. The milder shampoo and the scalp is still irritated. I've never had that experience. So we would need to check it under the scope.
Excellent, thank you.
I think the person could probably also, although it's not a question for me, but I think the person could probably also, like she said, the person has to be examined, because somebody who is used to looking at the scalp may look and see that the person has a seborrheic eczema or something that is causing this. So there may be a scalp condition itself that needs to be treated, and it's not just quote unquote sensitivity to the scalp. So they should be seen.
And it can be an open wound, it can be abrasion, and it can be that it is so sensitive that the person keep itching. And once you itch the scalp, you are abrasing the scalp, so you start getting open wounds. So anything, even if you sweat, it burns. So you definitely would have to examine underneath the microscope.
Claudia Grant asked the case of a young adult with acne who was diagnosed with a hormone issue. What recommendations do you have for acne caused by hormone imbalance? Dr. Barnett, quickly.
Okay, well, acne caused by hormone imbalance, it depends on what the hormonal imbalance is. If it can be treated, then we try to treat the hormonal imbalance that the patient has. I don't know if the person has, say, polycystic ovarian syndrome, then the doctor would give them appropriate medications, etc., right? So I'm not sure what the hormonal problem is, but we try to treat that if possible. And then outside of that, the acne is treated in the same way all acne is treated, basically, finding actives that work well for that patient. One of the things I spoke about was like vitamin A. We use retinase a lot. So a patient can use retinase. They can start off with over-the-counter stuff like benzoyl peroxide, a salicylic acid wash. Those are the main two things that you can get over the counter that tend to be effective. In recent time, persons can get different gel online. I think you can get it on Amazon. It used to be a prescription, but it is like a vitamin A analog as well. So I think if somebody really wants to try and help themselves and not necessarily be seen, they could try a salicylic acid wash, a benzoyl peroxide cream, and a different gel. You can get those things online and in some pharmacies. And of course, hormonal problem should be treated if possible.
Excellent. Last question I'm going to ask now. What are your recommendations for strawberry skin? Shawnee is asking. Dr. Barney.
Okay, when she says strawberry skin, she means like you've seen the pores like on the thighs.
I don't
like
know.
When people, I'm assuming that's what she's talking about.
Okay.
That is extremely difficult to treat. Basically what it is like the person has a little bit of clogged pores coming up on the skin, and many times it's like enlarged hair follicles or enlarged pores. And the only thing I would tell a patient, many patients, we don't treat it. After a while, we don't treat it. We explain to them what it is. It's not harmful. We don't treat that. If it bothers her greatly, she could use acids again. Sometimes you can do peels to try and improve the appearance of it, because it can give a kind of rough appearance to the skin as well. She can use over-the-counters like a mild salicylate or kojic acid or glycolic acid, but usually for a peel to be very good on the body, it would tend to be done by a professional, whether an esthetician or a physician, for it to really penetrate the skin on the body. But you could use a kind of exfoliating lotion. For home remedies, some patients will do stuff that has like sugar and honey and oatmeal and cornmeal, and that helps to exfoliate the skin as well, because it's kind of like blocked pores and sweat glands that are obvious, but many times it tends to come back, so it tends to be a repetitive process.
Excellent. So we're gonna be checking out now, guys. So before I go, I want to say again, thank you to Dr. Marsha Barnett from Jamaica via Turks and Caicos Islands. Right now, Trisha Reed, who is CEO and Managing Director for Shades of Elegance Old Harbor, for taking time out of what I know are busy schedules to spend all of 2 hours educating all of us for free. So guys, please remember to support Shades of Elegance, to Marsha Barnett. We thank you so much for your willingness to come and share. So I'm going to encourage everybody on the chat here. Yeah, man, definitely. On the chat here, you can go to the different social media platforms that we use on YouTube, on TikTok. And if you want to join our group, Tamara, can you put the link in the chat for persons who are not in the group to join, so they can get access to more content like this? And
it's
guys,
in the group, Dr. Thomas. Thank you.
What's that?
It's in the group. It's already in the chat.
Already in the chat. All right, guys. So there's a link in the chat to join our WhatsApp group if you choose to do so. And thank you, everybody, for coming out. Have a wonderful evening.
Thank you. Thanks, guys.
All right. Thanks for having me. Have a good night.
Thank you. Bye.